Season 2 Epidemics of Lyme Disease. Video number 3, January 2010. The following video is one of a whole series with a logical structure. Please also watch our other videos on this channel. European Lyme disease propaganda. Epidemiology of European Lyme borreliosis, propaganda of UCALP. This information is based on the publications of the European Concerted Action on Lyme Borreliosis and Lyme Borreliosis in Europe in 2006. Lyme borreliosis has been reported throughout Europe, where it is the most common tick-borne infection. Studies show that reported incidence in several countries increase. A large part of this increase can be attributed to the heightened awareness of the condition, resulting in increased diagnosis and reporting, and it is also known that overdiagnosis still occurs. There has been a genuine increase in transmission rates in some regions, according to the propaganda of UCALP. The heightened awareness and misleading transmission rates are the real cause for the Lyme disease epidemic. Public perceptions of the disease in Europe have been distorted by the media and by activist groups, with exaggerated claims of pathogenicity and of difficulties of diagnosis and treatment. The distortion by mass media and activist groups is the real cause for the impression of a Lyme disease epidemic. In fact, there is no Lyme disease epidemic. Diagnosis is clinical in the first instance, taking into account the risk of tick bite and the symptoms and findings on physical examination. Supporting evidence for a diagnosis of disseminated or late-stage disease must be provided from results of laboratory investigations, usually antibody tests. Without a positive antibody test on Borrelia burgdorferi sensu-lato, the patient is just suffering from media-transmitted hypochondria. All antibody tests are 100% reliable. Erythema migrans, the characteristic rash which may appear some days to weeks following an infection, is the most common manifestation. Neuroborreliosis occurs in approximately 20% of cases, arthritis in approximately 10%, and carditis is rare. In fact, not all antibody tests are 100% reliable. Be careful when describing your symptoms. Following newest results of neurological research, a list of many different symptoms is a typical sign of hypochondria. If you have 5 symptoms, you have a 50% chance to suffer from hypochondria. If you have 13 symptoms, you have a 90% chance to suffer from hypochondria. The most feared complication of Lyme borreliosis, late neuroborreliosis, is very rare in Europe. Recurrence of disease is known to occur, and the majority of these are probably due to reinfections, though relapses also occur. Complications of Lyme disease or late-stage neuroborreliosis are found so rarely because conventional medicine ignores them. In private surgeries, you may find a different view. Most patients diagnosed with chronic Lyme disease, both in Europe and the US, either show no objective evidence of current or previous infection with Borrelia burgdorferi sensu-lato, or are patients suffering from post-Lyme disease syndrome, which is probably an immune-mediated phenomenon. Chronic Lyme disease is an autoimmune reaction and therefore not related to any kind of pathogens. Co-infections do simply not exist. Attorney General Richard Blumenthal today announced that his antitrust investigation has uncovered serious flaws in the Infectious Diseases Society of America's process for writing its 2006 Lyme disease guidelines, and the IDSA has agreed to reassess them with the assistance of an outside arbiter. European Lyme borreliosis incidence. Few countries have made Lyme borreliosis a compulsory notifiable disease. Therefore, it is possible to make only approximate estimates of Lyme borreliosis incidence in Europe. In most countries, reporting is mainly conducted through diagnostic laboratories reporting on the available details of patients with positive tests. The healthcare industry is ruled by profit and not by altruism or humanity. Corrupt politicians and the pharmaceutical industry ruin healthcare systems by taking advantage of their political power and raising their individual profits. It is politically not wanted that Lyme disease is recognized as a notifiable disease in Europe. Do your own research. There are several drawbacks involved in using such systems for the estimation of European Lyme borreliosis incidence, including underreporting of erythema migrans, varying patterns of test referrals, varying serodiagnostic criteria, and seropositivity linked to past exposure. Within these limitations, it is possible to gain useful information from individual country systems through year-to-year comparisons of within-country data. Prospective clinically based studies yield the most accurate information on incidence. However, these are more costly in time and resources than indirect methods, which may represent the only means to carry out surveys in some areas. Indirect methods may include the measurement of the abundance of ticks, the prevalence of Borrelia burgdorferi infected ticks, and zero-prevalence studies. All of these indirect measures have weaknesses as indicators of Lyme borreliosis, but at present human zero-prevalence studies probably represent the best method to obtain epidemiological data throughout Europe. Taking the limitations of zero-prevalence methods into account, it is clear that Lyme borreliosis shows a gradient of increasing incidence from west to east, with the highest incidences in Central Eastern Europe. A gradient of decreasing incidence from south to north in Scandinavia and north to south in Italy, Spain and Greece has also been noted. Estimated average Lyme borreliosis annual incidence in selected European countries. In most countries, the reporting of Lyme disease is mainly conducted by laboratory diagnostics on available details of patients with positive tests. Patients with unrecognized symptoms of Lyme disease are not a part of these statistics. The data of the table is just the tip of the iceberg. The actual number of cases is above the official numbers. Depending on a list of factors, it is 2 to 10 times higher. European Lyme disease reporting is still dominated by systematic ignorance. There is still something going on. The number of reported and documented cases is very different from the real incidence. In the UK, 7 in 1 million people get officially infected with Lyme disease in a year.